Hi, Dr. Sasse here from the Continence Center at Sasse Surgical in Nevada. There was an interesting study recently that talked about prevention of incontinence that would occur otherwise after delivery, after pregnancy. And the study focused on using pelvic floor exercise or pelvic floor physical therapy, which is a program that we offer, and that the program being done during pregnancy, before any person had symptoms of incontinence, turned out to be successful in preventing the loss of continence after delivery of the baby. And so this was one of many examples of how a preventive strategy can bear fruit long term and prevent having to deal with a problem through other means later. I thought that was particularly interesting because I don't think that we take advantage of that strategy enough. In our center, we see most people after they've already tried a lot of different things to resolve their incontinence, their bowel and bladder leakage. Most notably, they've tried medications. In some cases, they may have tried other therapies like Botox injections, and in some cases, exercises. We think that we can do a little better with a more sophisticated algorithmic approach to biofeedback, an exercise pelvic floor therapy that involves some novel techniques that were actually invented by a colleague of ours who can help engage the muscles of the pelvic floor in ways that just simple Kegels don't seem to do. And so we try to encourage every one of our patients to take advantage of that program. But I think as a preventive measure, this makes a lot of sense to try to build up and restore those pathways and those muscles before the tissues are damaged, the nerves are stretched, and the muscles are torn. So I think this is a really excellent example of this kind of preventive strategy. I think it does apply also to other situations in which incontinence might be a consequence of a future event, not just pregnancy and delivery, but possibly surgery. I spoke on a previous video about anorectal surgery and pelvic floor surgery and how that can lead to incontinence, which can be quite severe. And so it would make sense that prior to such a surgery that the pelvic floor therapy that we provide would be something good to consider taking advantage of prior to the surgery and then be able to utilize after surgery as well. And then if bowel or bladder leakage is occurring after that surgery, then this is really a time to ask your surgeon and ask your providers, okay, what can we do to restore that continence or that control? Many times the provider community is just not that knowledgeable about sacral neuromodulation, which is the foremost and most effective treatment to restore bowel and bladder control. And in our view, the pairing of this sort of 2021 technology, computerized gentle current restoring the pelvic floor physiology, combining that with exercises, are ways to really re-engage the natural systems that Mother Nature gave us so that we can have restored bowel and bladder control with the least invasive intervention, without taking daily medications and without some kind of surgical intervention where surgeons are trying to stitch up muscles. And I think thinking about that in a proactive, preventive way is very likely to both restore the continence and control and also avoid more invasive therapies. So getting on that earlier is always better. So I thought it was worthwhile just bringing up this study, highlighting how reactivating our own natural muscles can prevent a problem. Pelvic floor therapy being done during pregnancy can prevent incontinence from happening after pregnancy. And then I would just add that if it happens after pregnancy, we would do more physical therapy work, but then we would also consider sacral neuromodulation to really restore those natural nerves and muscles, and normally to very great effect, resolving that problem in over 90% of cases. All right, well, I hope that's been a helpful idea to hear about, and I wish you the very best of health.